floods of 2010 in Pakistan dealt a deadly blow at both the economic and human level. The number of people affected in the unprecedented flash flooding in Sindh was around 7 million. Forced to migrate to drier areas away from the flooding Indus River, entire villages evacuated, leaving behind their belongings, farmlands, and domestic animals. Displaced and destitute, these families were in need of urgent assistance. RDF, with the support of Oxfam GB, took swift action to cater to the immediate needs of these vulnerable communities by effectively undertaking WASH, EFSL, and shelter initiatives. The RDF Oxfam GB interventions helped flood-affected families in the districts of Dadu, Jamshoro, Jacobabad, and Nowshera Feroz during emergency and early recovery phases. The aim of the emergency food security, livelihoods, and shelter interventions was to ensure that people had food to eat and a roof over their heads. Emergency cash support was also provided for purchasing medicines and other necessities of life. A number of food and non-food items were distributed along with household kits, winter kits, and shelter kits to provide instant relief. Cash grants and cash for work schemes offered small businesses financial support to set up enterprises such as village shops. Fertilizer and seed support was provided and livestock restored to farmers. Women were helped in the establishment of industrial homes where they used their stitching and embroidery skills to create clothes and handcrafted items for sale in local markets.
We implemented cash for work, unconditional cash grant for the most vulnerable communities, and also we distributing some agricultural inputs to the small farmers. And we do the business planning training in the communities so that other professional groups like a small business holder, home business holders, they can do their livelihood activities.
Men and women were provided with tools and paid for their work in constructing homes and cleaning villages. The shelter program focused on the building of houses for displaced and homeless families, with the full involvement of beneficiaries. Local people hired under the Cash for Work project were employed for the constructional work. The shelter design was shared with the communities and their feedback was an integral part of the construction activities.
हमारे पास RDF वाला है, उन्होंने आके हमारे साथ कुछ मदद की, ये मॉडल घर बनवाया यहाँ पे आके 3 महीने के बाद जो है हमें 40 घरों की छतें RDF वालों ने दिलवाई.
The design also incorporated features of DRR. Thus, RDF helped restore the livelihoods of these flood-stricken communities by encouraging them to stand on their own feet and provided security by giving them homes. Under the shelter projects, a total of 1,650 one-room permanent shelters were constructed in Dadu and Jamshoro, while under the EFSL support projects, approximately 11,290 families were supported in Jacobabad, Dadu and Jamshoro. Water, sanitation and hygiene was an essential part of RDF's flood relief work with Oxfam GB. The technical and financial support by Oxfam GB helped RDF ensure a prompt, timely and culturally sensitive approach in providing access of the affectees to safe water, good sanitation and the maintaining of hygiene. International standards such as the Sphere standards in emergencies were followed at all levels of the implementation of WASH activities. Through health and hygiene sessions, the RDF team sensitized its communities to the importance of basic healthy practices to counter the spread of waterborne diseases. Children, being particularly vulnerable, were specifically educated in special child-to-child sessions. Hygiene kits were then distributed and wash committees formed to ensure that standards of hygiene were kept in the village.
हाणे इन सफ़ाई जे बारे में जेकी असांखे सफ़ाई मिली, मिसाल सफ़ाई थी वई ॻोठ जी, मिसाल ॿारनि जी सफ़ाई, मिसाल पहिरें मानी खां अॻु में हथ धोअणु, लेट्रिन खां माना निकिरण बाद फ़ौरन हथ धोअणु, इहो तौर तरीक़ो इस्तेमालु कयो त असां बिल्कुलु हाणे बीमारी खां बची विया आहियूं.
Safe drinking water was provided through tankers, rehabilitation of hand pumps, installation of new bores, and the provision of aquatabs. The issue of poor sanitation was addressed through the construction and repair of pit latrines. Clothes washing in separate male and female bathing areas were also created under this initiative. Through the WASH project, the cases of waterborne diseases became considerably less, and a positive change was clearly seen in the lifestyle and daily routines of village communities. More than 32,000 families were supported in the early recovery phase in 3 districts of Sindh, and around 12,000 families during the flood emergency phase.
We're working with RDF, with our field teams coordinating very strongly on the ground to make sure that the programme is successful. And I think that's been one of our key successes in achieving the village development committees, which have been very successful in helping the beneficiaries and the project to be successful and in ensuring lasting impact.
In keeping with its participatory approach, RDF began its work in various villages after holding discussions with its target communities on the nature of their exact needs. As the projects commenced, villagers were directly involved in the progress of their communities. This approach created a sense of ownership in the villagers for the changes in their communities and ensured that these changes would be sustainable.
असांखे उहा मदद सही थी लॻे. असांखे सभु कुझु ॾिनऊं. असांखे साबुण ॾिनऊं, असांखे पेस्टां ॾिनऊं, असांखे रोड ठाराए ॾिनऊं, असांखे लेटरियूं ॾिनऊं, असांखे वाटर ठाराए ॾिनऊं, असांखे नलका ॾिनऊं, असांखे सुख भलो ॾिनो.
Coordination, communication, lesson sharing, discussing issues with Oxfam GB, UN clusters, and district governments were instrumental at all stages of implementation. RDF teams regularly participated in coordination meetings of Oxfam GB's partners in Sindh. Overcoming the sheer scale of the destruction and fulfilling the logistics of capably helping the affected population made flood relief work a challenge for all involved. But through strong teamwork, transparency, and dedication, and the technical and financial support of Oxfam GB, RDF has managed to successfully achieve the objectives of its projects. The close collaboration between Oxfam GB and RDF played a crucial role in the carrying out of an adequate, timely, and dignified response in this crisis, and underlined the humanitarian success of this partnership.